Good afternoon, everybody. So thankful that you're able to come out and join us in person or online. So welcome to today's InCHIP lecture. I'm Lanika Blackman-Carr, Assistant Professor in Nutritional Sciences for those who I might not know yet, but I'm pleased to introduce our speaker today, Dr. Chelsea Singleton. So I'll share her bio before turning the mic over to her. Dr. Chelsea Singleton is a nutritional epidemiologist whose research examines the impact of healthy food access has on purchasing behaviors, dietary intake, and chronic disease risk. The overarching goal of her research is to document and dismantle nutritional inequities affecting low-income populations and people of color in the U.S. Her recent work has primarily focused on describing the mechanisms by which structural racism and structural violence impede healthy eating in underserved communities. She has extensive experience working with nutrition assistance program participants, like our supplemental nutrition assistance program, Women, Infants, and Children, and primarily uses epidemiological, geo-spatial, and community-based participatory research methods to accomplish her research goals. Prior to joining the faculty, SBPS, that's a hard one to say altogether, she was an assistant professor of public health at the University of Illinois at the Urbana-Champaign campus. She completed a USDA-funded post-doctoral research fellowship at the University of Illinois at Chicago in 2018. In 2020, the National Institute on Minority Health and Health Disparities awarded her a 5-year KO1 grant, and this KO1 aims to study the effects of community violence on food retail and food purchasing behavior in low-income African-American communities. And of course, she's a proud Tulane and Xavier graduate. And so please join me in welcoming Dr. Chelsea Singleton. Welcome.
Thank you all for having me. All right, so I'm very excited to be here in Connecticut. This is my first trip to Connecticut. I've always wanted to visit it, but I'm very happy to be here right after y'all won a national championship. So congratulations for having me, because I know it's probably been chaos in the last couple of weeks. Because I was telling, we won the Cotton Bowl one time, and people at Tulane lost their minds. So I can only imagine how crazy it is after you win a national championship. So, but yeah, no, very happy to be here talking to you about some of my research. This work has been very near and dear in my heart. It's been something that it's kind of been like my sort of like brainchild, my love child for the last few years. And it started with my interest. I've always had an interest in understanding like nutritional inequities that negatively impact Black populations and Black communities in America. And I've always kind of been in the space of really trying to think about how do we expand healthy food access. And this research kind of came out of like issues that kept coming up during my time in Chicago. And I was thinking like, wow, like we really do have a community violence issue. And in the communities that I was working with and alongside some of the great leaders in the communities, they were telling me so much about the violence issue. And that started my interest in understanding the nutritional and health consequences of violence. So that's what I'm going to talk about today. And I wanted to start by saying I have nothing to disclose. I also wanted to show my positionality statement, which gives more information about who I am as a scientist, and how that shapes my understanding of health equity and understanding of the issues that we are going to be talking about today. Okay, so today I'm going to start out with a little bit of background information about health inequities for many people who might not understand or might not understand the current states of nutritional inequities in America. Then I'm going to talk about what do we already know about the connection between violence and nutrition. Where the research started, dating back to the 1980s and where we are today and how that is related to the work that I've been doing. So I'm going to actually talk to you about findings from 3 papers that me and my team are currently working on. And the first looks at the impact of community violence on food retail businesses in Chicago. The second is actually looking at exposure to community violence, self-reported exposure to community violence, and how that's associated with people's intention to eat healthy and among Black adults in America. And finally, a paper that I'm currently working on focuses on the nutritional consequences of being exposed to crime in food stores in people's communities. And this again focuses on the experiences of Black identifying people. All right, so a little bit of background information. So for decades, studies have documented nutritional inequities. I know a lot of the experts in this room probably know that, but for people who are online who might not know that, but there have been a lot of research done in this space documenting nutritional inequities by race, ethnicity in this country, socioeconomic status, as well as geographic location. So looking at the differences between the urban experience versus like suburban or even rural experience. And we see a lot of strong evidence for certain outcomes. So food security status, I know we have huge food security status issues both in Louisiana, and I do a lot of work in Illinois because I lived there for such a long period of time. I lived there for 6 years. We have major food security status disparities by race, ethnicity in these states, but also access to healthy food. That's been sort of my bread and butter of my research for a long time. I've been studying food access issues for a long time, and I mean, the USDA, the CDC have put out reports and even have data available documenting differences in communities that are low income, low access, and the racial composition and the economic composition of these communities, but also evidence around diet quality as well as obesity. And so we continue to see these nutritional inequities. So eliminating these disparities continue to be a major public health priority at the federal level, the state level, even the local level. We had a great White House conference recently that really put the nutritional inequities on the stage. I don't think they had one in like 50 years, and that really brought together experts from around the world talking about these nutritional inequities, but then also coming up with these recommendations and plans, sort of kind of a roadmap of recommendations that to address nutritional inequities. So that was great. It just shows that this is a major issue that's in conversation at the local level, state level, and even among our federal leaders. Because the ultimate goal really is nutrition equity. I tell my students that all the time. We do the work. Whether you are doing interventions, whether you are doing some type of policy change work, whether you're working like downstream or upstream, the ultimate goal is to foster nutrition equity in our country. So we want to ensure all people and communities have the necessary resources, environments, systems, and policies in place so that everybody can sustain a healthy diet. And we want to make the healthy option the easy option, of course. And we need to understand that these resources, these environments, the systems that we need in place might be different for different populations. It might be different for a population that's here in Connecticut versus where I'm living in the Deep South and on the Gulf Coast, because a lot of our nutritional issues are different. Like a lot of the stuff we do, for an example, is centered around climate change, because climate change is like a major issue for us because we're on the Gulf Coast, and of course we have hurricanes and we have coastal flooding is a major issue. So when we think about nutritional inequities and strengthening our food system in the Gulf Coast, is very much so tied to climate change. So that's understanding that it's unique for different populations and areas. And I truly believe that nutrition equity should be centered in all policies and interventions that people are developing to address nutritional inequities. And I'm seeing that shift. I'm seeing that call. I love to see that being discussed in publications that are coming out, this idea of nutrition equity and why it's so important. But in order for us to do that, we really have to increase our understanding of all of these upstream factors, these social, political, environmental factors that drive nutritional inequities. We need to increase our understanding of the social determinants of health, the commercial determinants of health, so on and so forth. And I feel like, hopefully the research I'm doing in this area is going to fill in some gaps. So I like to show this framework because I love it. I don't know how many of y'all know Dr. Shariki Kumanika. She's a pioneer in our field. But this is her Getting to Equity framework. It's published in the American Journal of Public Health. There have been lots of researchers that have used this and cited this in their own work. The reason why I like to talk about this is because she developed this framework to really support obesity researchers who are developing interventions that want to increase the equity impact of their work. So in this framework, she talks about different potential points of intervention if you want to address obesity issues. But I love the fact that she has in her quadrants, her top two quadrants, these sort of points of potential intervention, you have the increased healthy option side. And I feel like a lot of us work in that space. You know, we want to expand healthy food retail. We want to expand food access and improve school meals. You know, we're working in the school space. We're thinking about the built environment. How do we improve that? Transportations, the built environment. So a lot of us have worked in that space, and traditionally I have as well. But I love the fact that she also pointed out the need to reduce deterrence, because if we might be developing these wonderful interventions and programs to make the healthy options or create the healthy options or make the healthier option easier. However, we have a lot of stuff working against us, you know, and those are the deterrents. So, you know, you might want to promote healthy products, but we still have a lot of marketing and advertising in communities of unhealthy products. So that's a clear issue. We also have issues of discrimination, so on and so forth, that people are facing, and stigma. But I like to point out that I love the fact that she put threats to personal safety, because there's a lot of research in the physical activity space about how threats to personal safety negatively impacts people's ability or their motivation to even work out. So, and you know, being physically active is very important to obesity prevention. So I like to point out that, you know, when her thinking about these intervention points, she's recognizing that the deterrents are a major issue. And so that's what I think is a good segue into understanding violence. So that's what we're going to talk a lot about today is violence as a public health crisis. So I actually recently spoke at our class. We actually have a violence as a public health issue class in the School of Public Health at Tulane. And a lot of our students were, you know, are studying this. And I love the fact that our instructor, who's one of my colleagues, is bringing in people who are doing different types of research so you can understand how violence impacts so many different components of our lives, you know. But yes, violence is widely considered a public health concern. And I want to say, like, right before the pandemic, there was a lot of conversations about violence. APHA focused their annual conference, their theme was focused on violence. It's a risk factor for several adverse outcomes, not even health outcomes, other outcomes in life as well. It's a barrier to sustaining a healthy and active lifestyle. And it's a threat to community health and well-being. So we're going to talk a lot about that in our work today. So violence has been linked to several adverse outcomes. So in my research in this space, I've seen studies that have found that it's associated with substance abuse disorder. It's associated with so many different negative mental health outcomes. So depression, anxiety in communities. But one of the things I think that's probably the closest to the research that I'm doing is the relationship between physical inactivity and obesity and violence. So I would say that's probably the biggest, the most robust body of literature in this topic is the relationship between violence and adverse outcomes, specifically physical inactivity and obesity. And I've seen studies connect objectively measured violence. So that's like we actually pulling like that geographic data, crime data, 911 call data, and connecting that to people's physical activity rates and actually their obesity, their body mass index, but then also like people's perceptions of their community. So if they don't perceive their community as safe, then they're not as active. So this is a paper that my colleagues and I published last year in the Journal of Urban Health. We actually had some census tract level data in Chicago, and we wanted to see how that was associated with adult physical inactivity rates as well as adult obesity rates. So we used data from the CDC, particularly their social determinants of health, as well as the places data. So in this paper, we actually linked violent crime, which is this particular panel map, to percent obese as well as percent physically inactive. And as you can see, these darker spots have the higher rates in the maps. And this is actually the south and west sides of Chicago, which are mostly lower income communities. Also, a majority of Black and Latino communities are on the south and west sides of Chicago. And in this paper, we actually also looked at associations by neighborhood, racial, ethnic composition. And we actually saw that the relationship was significantly stronger in Black communities of Chicago. So that paper is available if anybody is interested in reading it. However, the literature on the relationships between violence and nutrition-related factors is limited in scope. So if you wanted to know more about what is available, I actually just found out this paper is online now. I would have put a QR code in, I'm sorry. But I'm going to send the link to Josh and he's going to link it in the YouTube video. But yes, so I published a commentary that came out literally today. So it's available online for you to read. It's in the Journal of the Academy of Nutrition and Dietetics. And in this commentary, I talk about the relationship. I really framed it around crime because violence is such a broad topic. And they really wanted me to really focus on one specific thing. So I talked about crime and the current evidence and my recommendations to advance nutrition equity research. But I talked about what we know already and where do I think the science can grow? Like, where do I think we can go in this space and connecting the two? And a lot of the things that I talk about in this are what has already been done in the past. Okay. And some of this research goes back decades. So for an example, there's research from the 1980s, and I feel like this probably the earlier literature in this space, connecting poor nutrition to delinquent behavior. So looking at children who might have nutritional inequities, deficiencies in their diet, who might be underweight, who might be experiencing hunger, or might just have like imbalances in their diet. They might be eating too many unhealthy foods, too much candy, too much sugar, and connecting that to actual delinquent behavior. So there's a lot of research that has been done on that. And some of it has linked poor nutrition in kids to adverse behavior, antisocial behavior, and even going to prison as an adult. So showing that sort of lifeline connection between nutrition and adverse outcomes. This particular area, I would say, has grown a lot, especially during the pandemic, because we had a spike in intimate partner violence and domestic during the pandemic as it relates to food security. But food and household food security status and connecting that to violence in the home. So child abuse, intimate partner violence, and domestic violence. And has been a strong correlation between the two. And this has definitely been a topic of much concern, especially during the pandemic, because we had spikes in both. We had spikes in food insecurity, and domestic violence increased substantially during the pandemic. And we see this relationship across countries, and it's not just in the United States. And I would say this is probably a newer connection that people are discussing. They're talking about the food environment and how your food environment is designed, what's available in your food environment, the density and availability of certain retailers, and how that might drive crime rates in your community. So I know dollar stores are a hot button of conversation in New Orleans, but all over the country. And I don't know how many of y'all know, but there are a lot of communities in the United States that are taking efforts to reduce dollar store growth. I think as of late, there's been over 60 policies that have passed. Chicago just recently passed an ordinance to slow the expand of dollar stores. And there's been different legal mechanisms that have been put in place for that. And that's because they feel like dollar stores are a crime magnet. And I actually wrote a paper that's available online that summarizes policies that have to slow dollar store growth and describing the legal mechanisms behind them. I worked with some lawyers on it. It was a really, really great project. But the key connection between these particular associations is that nutrition is the driving force. Like, nutrition is the independent variable in all of these analyses. So what I'm interested in is understanding how violence in communities negatively affects nutritional outcomes. I have a strong interest in understanding like the experience, like not just at that point in time, but understanding how it could change community nutrition over time as well. So that's what I'm hoping to do in my research. So I'm going to talk to you a little bit about my KO1 findings. So my KO1 research was funded by the National Institute for Minority Health and Health Disparities. So shout out to NIMHD for believing in me and actually giving me money. But the goal of this particular project is to explore the nutritional consequences of community violence in predominantly Black communities. And that's exactly what I wrote. I said, this is what I want to study. And I really had an interest in both the retailer experience, so understanding what's going on the food access side, because like I said, I've done a lot of research on food access, but then also understanding what's going on among the consumers. So understanding the experience of actual the people. So So today I'm going to talk to you about some of our research where we evaluated the effects of community violence on food businesses in Chicago's Black communities. And then finally, I'm going to talk about some findings where we looked at the relationship between community violence and some adverse outcomes. So we're going to look at intention to eat healthy, we're going to look at food insecurity, and we're going to look at obesity. All right, so let's talk a little bit about the impact of community violence on food retail businesses. So I will say the one thing that I found has been very rewarding in this research is that it's kind of forced me to step outside that nutrition and public health literature, because a lot of the work that has been done on this topic, they might not specifically be talking about this, but they might be talking about issues that are very related to such. So I've done a lot of reading of the business literature, a lot of reading of the sociology literature, a lot of reading of the economics literature, because they are doing work that I think is very relevant to this issue, but they're not framing it as a nutrition issue. They're not framing it as a community nutrition issue. So there's research that shows that food businesses are prime targets for crime. So they talk about the fact that a lot of food stores, they're understaffed when it comes to how many people there. They talk about the spatial size of the store and how that is related to the number of employees. Like you might go into a Walmart and considering how big the Walmart is, you don't see enough employees there, because the more people they have working there, that tends to be a crime deterrent. The same thing with dollar stores. Like you might go into a dollar store and they might have 1 or 2 employees on staff at any given moment in time. So when people see more people in there working, that often deters crime. So they'll talk about that. They'll talk about the fact that they have very limited security measures. They'll talk about how they often don't have like hired security guards, or they might not have working cameras, so on and so forth. So that, might not deter crime. And then many of them keep a lot of cash. They do cash transactions throughout the day. And then some of them stay open pretty late. Like some grocery stores, gas stations, corner stores might stay open very late into the night as well. So these issues are talked about a lot in the business literature. They're talked a lot about in the economics literature, but we don't talk about it a lot in public health and nutrition. And, when we're talking about health disparities, so on and so forth. And I also found it very interesting that some of the studies that I've cited and grants that I've written, they talk about how in communities with more violence and crime, they have less entrepreneurship. They have less people coming into the communities, opening businesses, and you see more business turnover. So even though this stuff is not in the nutrition literature, I believe it lays a foundation of what could be happening when it comes to food businesses in our community. Because when we're thinking about expanding healthy food retail, we have all these healthy food financing initiatives. Locally, we have federal healthy food financing initiatives, and the goal is to expand healthy food access, but we have to think about the forces that are pushing against that might be, impeding our ability to get these businesses to thrive and expand healthy food retail. Because at the end of the day, businesses have to make money. They have to be successful and they have to be able to thrive. So we have to think about these issues. So the goal of this particular analysis was to explore the effects of crime on food businesses in Chicago's Black communities using the mixed methods approach. So my students and I have been working on this. We started working on it in late 2022. So we did our data collection last year and we're finishing our paper right now. So for this particular study, we went to Chicago and we mapped the city, and we were interested in trying to find food store owners and managers who wanted to join the study, who were either, like I said, they manage a business or they own the business, to participate in our study. So what we wanted them to do is that we wanted them to do 3 things. We wanted them to fill out a brief questionnaire about their business. We did a food store audit. So we used an audit tool that was developed by the Prevention Research Center at the University of Illinois. So we audited the store to see what they carry, what they offer, and then also all of them participated in a very brief interview. Tried to keep it as short as possible because we were interviewing people while they were working. They had people coming in, checking out. When I tell you that this was probably one of the most challenging studies that I've ever had to do in the past, but it was very rewarding. So we also were in some of the most violent areas of the city because what we wanted to do is that we wanted to go to these specific types of stores because we were interested in the experiences of places where people actually go for groceries. We did not include fast food restaurants or full service restaurants for this particular analysis. I'm interested in their experience, but for this particular analysis, I really want to focus on places that people use to get any type of like food at home products. Okay, so we collected this data, we analyzed it with SAS software as well as in vivo. And like I said, we were interested in the experiences of certain areas of the city. So these red outlines are census tracts where we actually got people to join our study, but we were interested in places that had high violent crime rates. So they had to be in like the top 10% of our violent crime rate. I think for year 2020, like our most recent data. And then they had to be in the lower, they had to be on the lower side for median household income, but they had to have a percent Black that was greater than 50%. So that was our criteria for recruitment. And then the managers and owners had to have at least 1 year experience. So that was their only recruitment. That was their only inclusion criteria. They had to have 1 year experience so they can at least know the community and have something to say in terms when we ask them about how do you feel about community violence, how do you feel like it's affected your business, so on and so forth. They at least have some type of experience. So this is just some information about the people who actually joined our study. So we got 32 people to join. We were trying to get closer to 50, but we had a lot of people say no. A lot of people say no. I was actually surprised we got 32. I was actually very happy about that because we were struggling at first. But yes, so we have, on average, they were about 43 years in age. Most of them were men. So most of them identified as male, about 75%. So in terms of race, ethnicity, we did ask them that question. So about half of them they self-identified as Asian or Middle Eastern. And then about 28% identified as Black or African American. Many of them had a high school diploma or less. About 50% had a high school diploma or less. But on the other side, we did have about 38% that had a college degree or more. So many of them actually moved from other countries and had, a whole educational career and professional career in their country before they moved to America and started their business. So we talked a lot about that in our interviews, which was really nice. And then on average, they had been in their position working at that store. They either owned it or managed it for at least 6 years. So many of them had been in the communities for a long time. We had some that been there for like over 20 years, which was really nice. We had a good range. So we had a lot on the one side, a lot on the upper side. So we had a really good range when it comes to number of years of experience. This is some other information about the studies. So we had 10 of our stores that were represented were full service stores. So these are your grocery stores, supermarkets, and your smaller grocery stores. So we call them full service because that means that you can go and do your full grocery shopping experience there. Most people, you do their grocery shopping experience there. The other 22 stores were limited service stores. So these are your corner stores, your gas stations, dollar stores, liquor stores, so on and so forth. So this is a lot of the information from the audit. So 27 of them, which is about 84%, accepted SNAP benefits. All of the full service stores we expected, they accept SNAP benefits. About 77% of the smaller stores, the limited service stores, accepted SNAP benefits. So some key things to point out. That was very, I'm really not surprised in terms of sell fresh fruits and vegetables. So we checked the store when we did the audit to see if they sell any fresh fruits and vegetables, and only about 50% did, which was very interesting. I actually hoped it was a little bit higher than that since we had so much full service store representation. But yeah, no, not many of the limited service stores carry fresh fruits and vegetables. As you can imagine, that's significantly different across the store types. And about 88% of our stores had plexiglass or dividers at the register. So we audited the security features of the store as well. And I thought it was very interesting that most of the stores that you go into in the communities that we were interested in, there was some type of divider that separated the person purchasing from the person checking out. And we actually had a lot of conversation. I had a lot of conversations because I did half of the interviews, and there was one guy who interviewed, and he said, we have no plexiglass or dividers in our grocery store because we feel like that actually promotes crime. Like his mentality about it was completely different versus everybody was like, oh yeah, we put the plexiglass up so, we can keep our clerks safe. So a lot of different viewpoints about that. But I thought it was very interesting because, that was a pretty common standard security feature. So we've been analyzing the data with in vivo software to figure out, what's the social process, what's the experience, what's going on in the communities around violence and how that's affecting their business. So one of the definitely is going to be one of our key things that we've been discussing amongst, me and my research assistants is the fact that crime has really become like the norm in the community. It's become like the daily experience. So oftentimes it doesn't concern them or the community members as much, because we found it very interesting when we had owners speaking and they said, oh yeah, this neighborhood is not safe and there's a lot of crime going on. And yeah, we've had shootings and people, like drug activity on our property. But yeah, no, our store is pretty safe. Like it was very conflicting. And I think it's because that has become really their lived experience. And they might be saying stuff to us as an outsider to say, oh yeah, like one of the store owners was like, yeah, I've probably seen like 3 or 4 shootings at my business since I've owned it in the last 10 years. But when you get to the question about, do you perceive your store as safe? Do you perceive this store, like the grounds around your store, to be safe? They'll say, yeah, I think that we're fine. I feel like there's some connection there around it becoming the norm. So, so like you'll have, say, like we have cameras. I've seen numerous shootings. I've seen a couple of people who have died and passed away. We'll see that. But then, like one of our interviewees said, yeah, if a customer comes from far away, from another community, from another city, they're like, what's going on? If you live in the area, some people, they look at it as normal. It depends on where you're from and where you live. Your perception of things might be completely different. And, I think about that even with my own experience growing up in Atlanta. Like, I didn't know until I was an adult that I grew up in one of the most violent areas of the city. They're like, oh, yeah, the violent crime rate is like one of the highest in the city. I'm like, is it? I think it's just your perceptions of things might be very different. Another thing that they talked a lot about was how building a relationship with your customer base, like that mutual respect, that rapport, is necessary for crime prevention. They all talked about their customers and described them as like family. These are our family. We know them. We have a relationship with them. And it reminds me of a paper that I read about the connection between corner stores and people, and how people see the corner stores as like part of their family and their experiences. But yes, they talk about having great relationships with their customers. They've known them for a long time. So most of the young guys, like teenagers and stuff, I've been known them since they were young. So they do have respect for me. So anything happens, I'll ask them to leave. They talk about calling parents rather than like calling the police. So I actually really like the fact that we ended up getting into conversations about community policing and how do we police our community, rather than actually getting the police involved. And that brings me to their mixed thoughts about the effectiveness of the police and how they are, whether or not they're they're really a crime prevention deterrent, because they really kind of describe them as being a little inconsistent at times. So like one said, I've owned many businesses in the hood before, and this is the first time I've never met the police officers. But then one say, oh yeah, we see our police officers. I think it's probably district related. Like I said, we had interviewees participating from different parts of the city. So it might be related to like where people are. And then finally, many of them are very sensitive about how they're perceived. There is an ongoing conversation, like I showed that article before, about food stores and how they might be driving crime. And many of them are saying, I don't like going to community meetings and to city meetings and people talking about the liquor stores and the corner stores and saying that we are the problem. Like, none of us want crime in our business. None of us want crime in the area, So we don't like the fact that we're hearing that type of stuff, like if there's a shooting in front of your place, they blame small businesses, they blame us. And that's really not the case. Like, nobody actually wants that. We all want to do business. We want to be we want to be successful. We want to support the community. We don't want to have these issues. Okay. All right, so next I'm going to talk a little bit about a paper that my graduate student, my PhD student, Danielle, is leading. She's fantastic. I love her. She's in her first year of the program. But she and I actually did a survey with some of my funding from this grant. and we did an online survey. We were planning on doing it in Chicago, and then we decided to just do it online because logistics-wise, flying back to Chicago was really challenging. But we actually, in this survey, we wanted to survey our Black identifying people to understand, measure their self-reported exposure to community violence, and then see if that's linked with a number of different nutritional outcomes. So she actually has a very strong interest in healthy eating intention. So understanding like these sort of theories, like the theory of planned behavior, like if you plan to do well, if you plan to be healthy, you're often more successful. So, but you know, during her lit review, she saw a lot of research on sort of social and environmental stressors and how that can negatively impact somebody's intention to be healthy. So in this particular case, we were interested in people's intention to eat healthy. Okay, so she is actually writing a paper that assesses associations between self-reported exposure to community violence and healthy eating intention, again, among Black identifying people. So for this particular study, we actually surveyed 502 Black identifying adults living in the U.S. So we worked with a company called Cloud Research. They were actually fantastic to work with. If you're trying to do like an online survey, I really recommend it. So they specialize in helping people draw panels. Okay, so they have access to millions of active users on their platform. So they help you set up the survey, help you pay the participants, help you with the IRB, and help you with the set up the informed consent process, help you with the validation checking and everything. They do a really, really good job. So in our survey, we wanted to include a number of valid screeners. So we had people complete the USDA food security module. They completed the perceived stress scale, the dietary screener questionnaire, the DSQ, which was developed by the National Cancer Institute. And then they also completed the self-reported exposure, the survey of exposure to community violence. This particular survey is really nice because it has a lot of different types of violence, but then you can also break it down by subscale. So if you only want to include like more violent crimes, you can include that. And they have people talk about whether or not they've ever personally experienced it, whether they've witnessed it in their community. And based off their results, like their responses to each one is scored. So the higher score on the survey of exposure to community violence suggests that somebody has been exposed more in their community in their lifetime. So some of the results that I'm going to walk you through for her paper that she's leading. So she actually used a screener that actually focuses on like intention to be healthy, and she used the healthy eating subscale. So it asks questions specifically about over the next 2 months. Okay, so this is measured around the next couple of months. So people who said yes, the 58.8% of people who said yes, these are people saying, yes, I intend to eat healthy over the next 2 months, versus people who said they either said no or they gave a neutral response. Okay, so she found a lot of differences between the two groups specifically. Okay, so for an example, as expected, people who intended to eat healthy were older on average compared to the younger individuals. And like for an example, she also looked at SNAP participation. Okay, so about 40% of our study participants said yes, they were participating in SNAP. They got SNAP benefits. For the intention, it was about 32% of the yes group were on SNAP. It was a much higher percent of individuals in the no group who were SNAP participants. So we definitely wanted to control for SNAP in our models. So looking at the results, okay, so in her analyses, she ran different adjusted logistic regression models. So she actually has quartiles for the self-reported exposure of community health, okay, and her outcome is odds of intending to eat healthy. So that's her dependent variable. So she actually saw, this is the crude model, and then the second column, which is the B column, is the one that's adjusted. It's adjusted for age, marital status, education level, SNAP participation status, ethnicity, and urbanicity. Okay, so we see lower odds. We see lower odds of intending to eat healthy if you're in the high exposure group. Okay, so that's the highest exposure group. The reference group is the low quartile group. Okay, so that's compared to them. They had significantly lower odds of intending to eat healthy. And then she also had an interest in stress. So she actually ran analyses for stress as well. So this is people's response on the perceived stress scale. It also scores it. So based off of their scores, we have these 3 categories. Actually, those should be T's, not Q's. That should be tertiles. Tertiles 1, 2, and 3. I need to tell her to change that because I took that right out her paper. Before she submits that, I'm going to have her change that. But yes, this is showing lower odds of intending to eat healthy if you're in the 2nd or 3rd tertile for stress compared to that lowest tertile. Okay. And then she also ran the interaction effects. Okay. So she wanted to see if there was an interaction between self-reported exposure to community violence and stress. So the reference group for these interaction effects is the lowest level of stress and the lowest exposure to community violence. So we considered them to have the lowest risk. So we made them the reference group. So when you get down to these higher categories of exposure, we see lower odds, significantly lower odds of intending to eat healthy over the next 2 months. So this is Q4 times S2. So that's the 4th, that's the highest quartile of self-reported exposure to community violence. And then that second group for stress. And then this is the highest group, highest exposure to violence, highest stress level, lower odds of intending to eat healthy. And again, like I said, everybody in this particular group in this analysis are all Black identifying, and then these are all adjusted for various different, all of our covariates. Okay, and the last analysis I'm going to talk to you through before I wrap up and take questions is a paper that I'm leading, and I'm actually going to be presenting at ISPNPA next month. I don't know, I all of a sudden thought of embargo rules. But this is unpublished. It's not published. So, yes, I was like, I don't think I'm supposed to be presenting this anywhere else. But, nevertheless, I'm going to be presenting this at ISPNPA next month. But in this particular study, I was interested in understanding how often are people even exposed to crime in food stores? Because there's a lot of research, again, not in the nutrition space, but there's some great research in the injury epidemiology space around being injured and being victimized when you are out shopping, okay? So injury research suggests that consumers have high risk of injury when a crime is occurring at a retail store, okay? And that risk increases substantially if the employee confronts the assailant. That's why oftentimes in businesses, they train their employees to not confront assailants because it actually increases risk of injury and death among the consumers as well as the people working in the store. So there's a lot of research around that, but nothing that has really focused on quantifying how often do people, are people ever victimized? Like, have they ever witnessed a store? Do they avoid food stores in their communities due to crime? So these are the questions I wanted to ask in this analysis. So I aim to explore the nutritional implications of being exposed to crime in food stores. So this is a big table because this is a lot of stuff, but I'm going to walk you through some numbers. So again, 502 Black identifying adults responded to our survey. We actually had 150, which represents about 30%. They said, yes, I avoid 1 or more food stores due to crime in my community. So we asked them specifically about their community. We gave them a definition of crime. And we actually gave them a list of different examples of crime that we were looking for. Homicide, we were interested in shootings, we were interested in gang activity, drug activity, so on and so forth. So yes, 150 said, yes, I avoid food stores due to crime. And there were some key differences between the groups that said yes and no. So actually on average, those who said yes were younger, slightly younger. And then also there was an association between SNAP participation. So more of the yes column were SNAP participants compared to the no column. And then the other question we asked was, have you ever witnessed a crime at a food store? And again, we gave them a definition of crime, and we actually gave them some examples of crime that we were looking for. So they had to just say yes or no. And again, we saw some clear differences. Again, on average, slightly younger in age for the people who said yes than no. And then more SNAP participants in the yes group compared to the no group. And then we asked them, if you said yes, tell me what type of store do you avoid? Tell me what type of store have you witnessed a crime? So this was a check all that apply, okay? So for the 150 people who avoid food stores, at least one in their community due to crime, we had them check off the store format, and we gave them examples of different store formats for each one. So the top three for avoid food stores due to crime were supermarkets and grocery stores. Okay, so about close to 50% said, yes, the store that I avoid is a grocery store or a supermarket. And then about 48% was a convenience store. That includes corner stores, gas stations, and bodegas. We put them all in the same group on the survey. And then the next highest category for avoids food stores due to crime is actually Supercenter, which I'm actually not surprised about. There's a lot of literature about crime at Walmart. There's a lot of studies that have been done about Walmart's crime problems. So this has been stuff that's popping up in the published literature, but also that sort of gray mass media, news media literature about Walmart and its crime issues. So I'm not surprised there. Now, witness the crime at a food store. The store type with the biggest response was convenience stores. Okay, so 52% of the people who said I've witnessed a crime at a food store selected that as an option. So we gave them a check all that apply because they might have witnessed crime at multiple different types of stores. So 52% said convenience stores. The next highest, I believe, is supermarket and grocery store. And then after that is dollar stores for witnessing a crime at a food store. So those were the top three formats for that question. So I wanted to see if avoiding a food store due to crime and witnessing a crime at a food store was associated with low food security status as well as obesity status. So everybody completed the U.S. food security module, the 6-item one, and we scored it to see who was food secure compared to low security and very low security. So we were modeling low food security. That also includes very low food security. Okay, and we actually saw this first column is the crude model, so it's unadjusted. Second column is the adjusted model. So both of them were significantly associated with higher odds of low food security. So those who avoid food stores due to crime, their odds was 1.94 times higher, 3.14 times higher if you witnessed a crime at a food store. For obesity, we had people self-report their height and weight. Since this was an online survey, we didn't collect objectively measured data like anthropometric measures. So we just had people self-report their height and weight. We only had 432 people self-report their height and weight. So just know that this sample size is slightly smaller. We actually saw a relationship between avoids food stores due to crime, but for whatever reason, witnessing a crime at a food store was not statistically associated with obesity status. So after adjusting for all of our covariates, avoiding food stores due to crime was associated with 2.15 times higher odds of obesity. And like I said, there was nothing associated with the witness of crime at a food store. I have no explanation for that, but that's the data, okay? All right, so just some summary and then summary of findings. But yes, so despite reporting experiences of violent and non-violent crimes at their food stores, many of the individuals who participated in our interviews in Chicago's historically Black communities, they perceive their store as safe, okay? So again, we think it has something to do with the relationship they've built with customers as well as them seeing crime as a norm. But when we ask them specifically, have you had crimes here recently? About 70% of them said that they've had a crime occur at their store in the past 30 days. And many of them mentioned that they've had many violent crimes occur in the area. However, when we're asking them about how we feel like it's affected their business, what's going on, they're like, oh, I think we're doing okay. So yeah, that's the experience, okay? Next, Black adults who self-report high exposure to community violence have low odds of healthy eating intention. Stress appears to exacerbate the effect of violence exposure on healthy eating intentions when we saw the interaction effects. And then finally, being exposed to crime in local food stores was associated with increased risk of food insecurity and obesity. Specifically, if avoiding food stores was associated with both. Witnessing was associated with only food security status. So finally, my concluding remarks, I think that the current evidence suggests that community violence might be detrimental to nutrition and health of Black communities. However, there's not a lot of research in this space. I think that there's a lot of work there's so many research questions I have that I want to answer. I think that we can like definitely grow this and grow this research space, but also growing all of our research around social determinants of health, as well as community, social, political factors that impact our nutritional well-being. I think that we need to develop policies and programs that foster nutrition equity. We need to strengthen our scientific evidence on the relationship between violence and nutrition if we're going to continue to try to expand these sort of policies and programs that are supposed to improve community well-being around nutrition. And finally, I really think we need to fund more transdisciplinary research projects where we're bringing different people to the table. We're bringing the nutrition researchers, we're bringing the sociologists, we're bringing the criminal justice and criminology experts, we're bringing the geographers, everybody to the table, and we're blending and using very innovative research methodologies, because I feel like that's the type of work that needs to be done now. Moving forward, wanted to focus on the fact that NIH funds a lot of research on violence, but not many of them are funded by the institutes that mostly fund nutrition research. Okay, so I like to point that out because even though they might be funding violence research, a lot of it might not be funded by the institutes that traditionally fund a lot of us in the nutrition space. So yeah, I want to acknowledge my entire team who helped me. Feek is my partner in crime. She's a geographer and she's an absolute genius. All of Dr. McLaughlin, Dr. Sheehan, and Dr. Rose are all my KO1 mentors. And then Lindy, Danielle, and all of my KO1 staff, my students, they are all fantastic. Would not be here without their help, as well as my funding sources that really kind of started this work and continue to fund this work. So thank you. You can connect with me via email or you can follow me on Twitter. We can connect more afterwards. And thank you everybody online for joining us today as well. Oh, it's up there. Hi. I keep forgetting it's up there. All right. I can take questions from, I think we have like 10 minutes for questions or like 7 minutes for questions.
We all monitor YouTube online, but
yeah.
We start here.
Okay, go ahead.
So I was wondering what you think might be the mechanism or the mediator that's like connecting these things. I mean, do you think that it's like stress and cortisol, or like what do you think is going on here, especially obesity, the intention to eat healthy, where do you think that what's kind of mediating this relationship between crime and obesity?
Yeah, I think there might be a lot of things that's like a lot of steps to get there. Yeah, I think it could be like something like more biological, like you said, stress. That's why Danielle was interested in like looking at the impact of stress, even though we just had them do the stress scale. We didn't collect any biomarker data, which I think would be really interesting to like collect more of that data to see, definitely see, because I definitely think there's a lot there, especially looking at the obesity for the last study, looking at avoiding food stores, because I'm like, I wanted to know more about like, okay, so if you avoid this one particular type of food store, where are you going? Like, are you making a choice to go someplace unhealthy or less healthy that has less healthy options because this store has crime? See, those are the types of additional questions we need to dig into, because I feel, and then you're eating less healthy stuff, maybe that might be related to obesity, or maybe like you avoiding food stores because you've witnessed crime or crime is occurring there. That kind of lowers your spatial activity size, like your spatial activity space for nutrition. And maybe that increases your risk of food insecurity because you feel like you don't have any place where you can actually get food in your community. So yeah, that's a lot of stuff I want to untangle. I feel like there's so much work that can be done there. I feel like there's a lot of stuff that's in between. So I'm hoping, I actually I was telling you this, I put in an R01 in February to expand this work to really focus on families and their shopping experiences. And I actually do want to collect a lot of the data that I feel like is missing in the gap, that fills in the gaps, that could answer that what's in the middle between like the variables, the questions I asked them that served as the independent variables compared to these dependent variables. I also want to collect more data that better represents like the nutrition of what people are buying and eating, because we only ask them. I think we have some data on fruit and vegetable consumption that we still need to score and see if that's associated. Other than that, I didn't have any data on like what they're buying and what's the nutritional content of what they're buying. That could also be something that's related, but I feel like there's a lot of stuff that's missing in the gaps.
I wonder too, and you sort of got at this, is people don't want to leave their houses.
Yeah.
So they just order takeout.
Yeah,
right?
that could
And
be it
it's
as
like
well.
Uber Eats and Instacart.
Yeah,
whatever,
and we don't
like
ask them anything
the
about
restaurant,
that.
the whole restaurant thing, and all,
Yeah.
and I think that's also a byproduct of COVID as well.
Yeah.
And the plexiglass thing, I was wondering too, if like that's like partly COVID related, or is it
Yeah.
COVID related? And
I didn't even ask them about the plexiglass. Was it there before or after the pandemic? Yeah.
But I wonder about this sort of like, avoiding going out and how your world shifts as a result of that. And it's not just, nutrition, but it's also physical activity. That
definitely. Yeah, I definitely think there's a lot of work that can be done there. And that's why I'm happy to be working with like some geographers, because they're like, you can do a lot of really interesting stuff with like GPS technology. It's hard work, definitely, but you can really get at these sort of issues of like, are people going out? How far are they traveling? What all places do they go to pick up food? And like really looking at the sort of spatial activity size of like their shopping, their food shopping for their family and their household. Because that, I feel like this is a really good first step, laying down that initial foundation, showing that there might be something there. And now it's time to kind of build upon that and do some studies that are like better designed from a methodological point of view with more money. So yeah, go ahead. Oh, whoa.
Go ahead.
Yeah.
So I was just wondering, and you gave a wonderful presentation. I enjoyed it. I was just wondering if somebody or a community or a group of people who experience the nutritional violence, if you were to like design an intervention or like target an intervention for those people, like what would be the strategy, or would it be through a behavioral route, or what would be the route of it?
I feel like that's a good question. I think my ultimate goal with this work was to really kind of help people understand that like crime prevention is like really important to nutrition. I think we need to do more crime prevention type of interventions. I feel like that's something that really we're taking into like local law enforcement and our policy makers, our community leaders, to really kind of like really pushing them to really do better, develop better design strategy. I mean, there's a lot of communities across the country that do really great crime prevention work, but there's still a lot that needs to be done to deter crime, so on and so forth, to support businesses. I feel like that's something we're moving like really upstream with that. Because at the end of the day, I honestly think like this particular issue, there's like no behavioral issue. Like I feel like there's no behavioral thing I can design. Like, oh yeah, I want to help people. The issue is crime. Like that's the issue. Like at the end of the day, the issue is crime. I think that this is the evidence that we need to show to start putting crime issues in a different context. Because I feel like a lot of the conversations around crime and crime prevention, developing policies and programs in cities, they're talking about a lot of the same thing. I think we need to be talking about like the other ways that it's negatively affecting people's lives. We need to talk about if it negatively affects businesses and the economic impacts of that or something. We need to start putting these conversations in different contexts. But in terms of developing an intervention that's going to change behavior of individual people in Black communities, there's no intervention I would develop. My intervention is let's fix the crime issue in communities. I don't know. I guess that kind of answers. I wanted to say that I'm not an interventionist. I tell people that all the time. So I'm definitely not the type of person. I'm definitely not the best person to talk about designing interventions in the first place. I do a lot of observational research.
Well, and my question was sort of related maybe in those interviews. I think those interviews that you did with the store owners are really interesting. I have sort of two questions. The first was, did you hear anything from them that would be kind of like what their wish for the alternative would be? Like, what did they sort of give you an inkling of what they envisioned for kind of another way or kind of a better future? And then I also wondered if they had sort of conceptualized the problem as getting worse over time. You had said like
crime has become the norm, or violence has become the norm. And is
Mhm.
that a process that occurred over time? Is this a sort of a process that's or a phenomenon that's been entrenched for a long time?
Yeah.
There's some narratives around like changes in crime since the
Yeah.
pandemic and 2020 that I don't even know if they match true crime numbers, but there's narratives around it. So what
Yeah,
do you
definitely.
find as far as trends and what people kind of envision for a better future?
Those are two really good questions. I will say that those two questions were not part of our interview guide. But we were getting a lot of feedback about those two questions, just kind of anecdotally, like they were just bringing it up, just like saying, hey, our community needs more X, Y, and Z. But yeah, no, many of them gave their their unsolicited thoughts about the things that they would like to change in the community. But it was great hearing like what they believe. So many of them just talked about like more support for unhoused individuals, more support for individuals with like mental health challenges that might be unhoused. They talked about like more youth programs to keep youth occupied after school, so then they're not hanging out in the streets and not hanging out in front of corner stores, and getting into having all types of issues to fight. Because many of them talked about petty theft and fighting. When we asked about specific crimes that you are dealing with and you are experiencing, they said we always have issues with petty theft, we always have issues with fighting, and we always have issues with just drug activity, hanging out outside of our stores. Like we try our best to stop loitering. But they talked about like having these particular programs, but many of them, since we didn't specifically ask about it, I wish we had. It was kind of sort of like here and there in the interviews, not enough to really kind of draw like an actual conclusion about thoughts, like make that be a key theme. And the other thing, what was the other question?
The past.
Oh, yeah. Okay. So, that's another thing. We didn't specifically ask them, like, do you feel like crime has gotten better or worse over time? But many of them, it depends on the area. I did have a lot of people say, oh, yeah, it was worse like 15, 20 years ago. It's definitely has gotten better. I think in general, crime in Chicago has gotten better in the last like 5 to 10 years. Chicago is no longer in like the top 10 most violent cities in America. If people are still talking about it, I think a lot of it has to do with perception. I don't know how things have changed since the pandemic. Nationally, we did see a uptick in violent crime in America. I think it was like the first time it went up. Violent crime has dropped significantly in America since the 90s. Violent crime in America in the 80s and 90s was so bad because we had a lot of social issues in America. We had a crack cocaine epidemic that was going on, and it has dropped every year since. And then like a couple of years like into the pandemic, it ticked up. But I think it's leveled out since then. But I don't know like if that's the case in Chicago, like what their trends. But many of them have said, oh yeah, it used to be really bad, but it's gotten better. But they did talk about how it negatively affect their business. They've talked about having to change the security features, how they've had to put in more money for security features, so on and so forth. So in our paper, we have the qualitative results, like what people are saying. But then we also have some results that we quantify, like them talking about their security features and the ways in which the different types of crimes that they've experienced and how often that was discussed, like how often that was mentioned frequency-wise. So we're going to talk about that in our paper as well. Those are two really good questions. I think we might be over time.
Yeah, we're at time, but thank you everybody so much for coming. Thank you, Dr.
Thank you for having me. Thank you all for joining us.